Namaskar, welcome to this last module of this edition of the annual refresher program in teaching, the course called Emerging Areas in Hospital Planning, Design, Construction and Facilities Management. I hope you have gained information, knowledge, skills and attitudes required to teach hospitals as a building type, as institutions and as service oriented buildings to the students of architecture at the undergraduate level and postgraduate levels in the schools of architecture in India. I am Dr. Anil Diwan, Professor of Architecture and Head of the Department Building Engineering and Management at the School of Planning and Architecture, New Delhi. I am the course coordinator for the present edition of this course, which we have presented to you. In this module, I am going to summarize the journey of all the modules that we have planned, prepared and presented to you. So, what are the teaching learning materials which we prepared for you and presented them to you? We want your feedback on the first run of this course and how we may improve it for the next editions of this course. We want to fill in the gaps of information, knowledge, skills and attitudes that we may have still left in this course and the gaps which we may have to fill in for the next editions of this course. So, in introduction, what I want to ask you is, did you see the introductory module of this course? Where did you get to know about this course? How were you invited to this course and when did you join this course? I hope you are doing the assignments which we are giving you at the end of each module and you preparing yourself for the end of the course exam which you will have to do to earn the certificate you will get from the School of Planning and Architecture, the AICTE and the MHRD for doing this course. This course is complete only after you have done all the assignments which we have given you, which is the internal assessment of this course, which gets around 30% of the total credits and the 70% of the credits are for the end of the course external exam which is conducted by the National Testing Agency. So, if we go module by module, the first module gives a brief introduction about the annual refresher programs in teaching and the massive online training programs which we have in relation to the SWAYAM courses. So, the platform, the course, the credits and the systems and the 4 quadrants, this is what we have been talking. I hope you understand these concepts. Even if you have some questions at this stage, the discussion forum is open and we would like to answer your questions to all the participants who are taking this course, so that any question you have could be answered to all the participants. Now, this program has been launched by MHRD in association with AICT and by making SPA New Delhi as the National Resource Center for Architecture courses. Please answer all the questions that we are asking you at the end of each module to earn your internal assessment credits. I am repeating these things again and again because the feedback I am getting is that people are coming, they are watching the videos casually and they are not referring to the reference materials, they are not studying whatever we have given in the reference materials, they are not asking questions on the discussion forum, and they are not answering the multiple choice questions which we are asking on the modules which we are presenting to you. The final end of the course exam will be conducted by an external agency which is the NTA. So, please enroll yourself for the external exam. So, only then you will earn your certificate for this course, which is very important. So, now let us come to the beginning of the beginnings of this course. So, we started this course with the definitions of health and wellness. We talked about what is health, what is wellness, and we gave you the concepts of fitness. So, we started with health and wellness centers, and we said the community and society should be coming towards fitness. So, we gave the importance of health and different types of health, and we did components of wellness. All the modules that we shared with you were in continuation with each other, and there were interlinkages in the concepts. There were some repetitions and there were some overlaps which were deliberately done so that the concepts could be reinforced and people could absorb them at the initial stage, or later the concepts could get clear to the participants. After the introduction, it was very important for you all to know how the healthcare delivery facilities have evolved in coordination with the human settlements. So, we talked about rural settings, we talked about tribal areas, we talked about semi-urban areas, and we talked about the urban settings. So, we talked about class 1 cities, tier 2 cities, tier 3 cities, tribal healthcare and rural health systems of India. So, as it is done in any course, we started with the history and the evolution. We did site planning, site selection, and the critical factors in these were covered in bits and pieces, and all the jigsaw puzzles were combined together. So, the evolution of the hospital buildings, the typology for healthcare delivery facilities were given in different modules slowly and gradually. So, the healthcare facility evolution and the delivery of healthcare and understanding of the role of a hospital, the definition of a hospital, the several healthcare delivery structures over the periods of time, from a sub-center to a primary health center to a community health center, sub-district hospital, district hospital, medical college teaching hospital, and an AIIMS level of epic center were clearly told in an hierarchical manner, so that every person has access to a healthcare delivery facility within the community. So, apart from other countries, what are the systems of healthcare that are there in the developed economies, which are the high income economies, the low income economies, and within India the different regions having different healthcare delivery systems, as health is a state subject in India. What is very important to know is that there are more than 450 colleges of architecture in India, where this subject is taught as a service oriented building or an institutional building. So, the students of architecture in 3rd years do a hospital kind of a building. In 4th years, in the choice based studio, people design a service oriented building as a hospital building. We also have students doing the hospital typology in their thesis. So, people are doing hospice, people are doing medicities, people are doing AIMS like facilities, people are doing a medical college teaching hospital where they are designing the total campus and maybe detailing out just the hospital or just the medical college building or the housing with it or the total campus as a group. Different schools, different colleges, different students do it as a collaborative exercise and as a individual exercise. So, we have to learn to teach them to do whatever is required for them to be learning this. So, we are studying the ideology behind the evolution of healthcare and how it has become imperative to study the planning requirements as influenced by the rapid modernization and growing populations in the different regions of this country. So, the designing of a hospital or a healthcare facility is done in certain stages. So, what are the stages? The first stage is the formulation of the planning principles or the planning guidelines. So, they could be the standards we have to absorb or use or follow, the codes, the codal provisions, the norms, the guidelines, the building bylaws, how we have to select a site, what is the feasibility and viability of the projects, what is the socio-economic analysis we have to do to locate a hospital, to decide the type of the hospital, to do the SWOT analysis and the issues related to the project. So, now at a stage we have come and we have talked about a program, a project, the designing, the pre-construction stage, the construction stage of a project and the post-construction facilities management of a project. So, we started with site planning. Now, site planning is done by landscape architects, urban designers, architects. The planners give us the planning parameters to be used for a particular site. What are the development controls? What are the heights? What are the planning principles which we have to study from the building codes, the standards developed by the National Building Code, the Indian Public Health Standards and the International Facilities Guidelines or the Health Facilities Guidelines India. All these have been given as a reference material with this course to design a healthcare delivery facilities. So, the standards are related to the planning of spaces, the departmental spaces, the infrastructure requirements for a hospital, the hospital services such as what we have to do for prevention of fire, detection of fire, fire fighting and rescue of people in case after the fire, where do the people assemble, how do we account for the total number of people, and in a hospital setting, the persons, the people, the patients are on life support. They could be on a ventilator support, they could have a heart lung machine, they could have a dialysis machine, or so many equipment could be attached to a patient. So, there is no chance of a electrical failure. There is no way that the frequency of the electricity or the electricity voltage could trip, or such things should not happen in a specialized institution like hospital. So, we have to understand all the laws which are related to the commissioning of hospital, the qualification and conduct of the professionals who work on the various issues like environmental protection, management of patients, safe storage of drugs, etc. Because even if we have able to save a patient, the patient is not stable outside without the medicines and the drugs which are required for the patient. So, we have to study, we have to understand all the laws and bylaws that are required for these patients. So, these steps have been explained in the modules about the legal framework of a project and the legal practices propagated in this business of setting up of a hospital, constructing a hospital, the pre-construction stage in a hospital, the facilities management and decommissioning of a hospital. So, we have even taught how to read and interpret a technical drawing. Why we have done this is, we have done this because our intent is to make this course open to doctors, nurses, medical professionals, engineers, architects and students of all the other disciplines also. So, it's a kind of bridging of all the professionals is required so that they understand what is a preliminary project report, a detailed project report, a feasibility report, what is a design brief. So, the idea was to make the people understand and know the concepts, the technical jargon which various professionals use when they are working in an intersectorial multidisciplinary teams, because gone are the days when architects could work in isolation in their own ivory towers. Now, architect is one of the many professionals who work in a team to design, detail, construct a hospital. But we are doing facilities management, commissioning and decommissioning of a hospital also, because these aspects are related to the design stage of a hospital, because the location of a hospital, the orientation of a hospital, the configuration of a hospital can be decided, designed and detailed by an architect only if he has the understanding of the facilities management stage of a hospital also. So, the reference to the project brief and the project manual has also been given in these modules. So, there is a detailed module on urban design for hospitals, because it is a township level of a hospital, site planning principles for hospitals. So, in this module we have covered the concepts of campus planning and design, the orientation of buildings, very important, because these decisions are the most critical decision for the total life cycle costing of the buildings. The morphological characteristics, the approach to redevelopment, because redevelopment is what is happening to most of our projects which were done post independence or in the 1920s and 30s, when there were a lot of developments that happened in India. And so the module explains about the guidelines for site planning. The master planning of hospitals was another very important module. After learning site planning principles, the understanding of master planning of hospitals comes into play, which includes the elements of master planning, the considerations that you have to take care of while doing master planning, and the relationship with urban design and landscape architecture and its considerations. So, we have to understand that what is the role of a planner, a regional planner, an urban planner, a master planner, an urban designer, a landscape architect, and the interior designers while doing the building or the campus or the group of buildings called a hospital. So, introduction to architectural design was a very important module, wherein the balancing of form and function was done by two practitioners who were actually doing a hands-on exercise, wherein they told how they followed the basic concepts of designing from a small part to the detail and coming from the site planning to the individual department or a room. So, what were the different approaches taken? What is given in the guidelines? What is the planning grid to be taken? What is the hospital design approach which masters have taken or which people take to design? How do they design the ambulatory facilities, the OPDs, where there is a lot of overcrowding in the Indian conditions? How do we design the accidents and emergency departments, wherein we have pediatric patients, we have women coming with maternity issues, gynecological issues, the medical emergencies, the surgical cases and the disasters, wherein multiple people come together. How do we have a separate zone for the inpatients, wherein we give them healing environments? What are the various other departments which we are taking for the hospital, like the laboratory services, the administrative services, the support, hospital support services, the engineering support services and the medical support services. To give a few examples about the designing of blood banks, they could be independent, standalone or the other departments. So, we have to do the interior designing, the wayfinding, and how do we do lighting in hospitals? By lighting we mean the daylighting design and lighting for artificial light at night or for the large spans wherein the natural light does not reach the certain areas of a hospital. Also, there are areas which are sealed and which are always working on artificial light. So, it is very important to have very good wayfinding for patients, for visitors and for all the people who come to a hospital building. Non-handicapping built environment is a very important mandatory requirement which we have to fulfill, because in an hospital, from a small child to a very old person, the infirm people, pregnant ladies with prams, differently abled people, people who are mentally challenged, who are not balanced, who are on wheelchairs, on stretchers, on crutches, using walkers, they have all to use a hospital facility. So, this module we have covered the handicaps which buildings give to these people and how these people are affected by these barriers, the types of disabilities, the mobility devices, the site planning, the detailing, the construction for our hospitals for these things. So, these are all mandatory national programs. Design of Ayush hospitals is also a very important national priority, which has been covered in a separate module, wherein the healthcare facilities, how they have evolved through times, and the allopathic, homeopathic, Ayurvedic treatments, and how we have been promoting the other systems of medicines, the Indian systems of medicines, which include the Ayurvedic systems, the Unani systems, the Siddha, naturopathy, etc. So, in this module we have discussed Ayush, Ayurveda, their design guidelines, objectives of Ayush, the minimum standards and the planning principles that are required for the Ayush hospitals. So, integration of Vastu and Feng Shui, these are also like the bylaws or the laws which have for an hospital. So, if there is a requirement from the users, from the clients that they want a Vastu correct hospital, we as architects should be able to give them architecture which has orientations and healing environments as per the Vastu principles. So, what is the importance of Vastus in hospital? The concepts of Vastu, the site planning principles and the design guidelines have been explained in this module. A very important module on teaching medical colleges and hospitals. So, in this module we have given the evolution of teaching hospitals, the various teaching hospitals in India, their planning and designing differences required. So, the classification of hospitals, what is the difference between a teaching and a non-teaching hospitals, the case studies, the examples, and we went all the way up to an AIIMS kind of a hospital. And how do we design them? How do we do them? We had students here coming and explaining how they were designing their hospitals and what were the criteria, what was the methodology, how they were doing it hands on was explained by them in a module on origami techniques which they used to do the form, to understand how they were articulating their sections, their elevations and the roof forms of the medical college teaching hospitals which they were designing and which was presented as a separate module to you people. So, we came to very important concepts in a hospital wherein we talked about how infection is transmitted in a healthcare setting and what is the role of building professionals to prevent infection from transmitting from one patient to another or from a healthcare worker to a patient or from the building how people could get infection and what building professionals could do about it. So, this was the multidisciplinary approach we adopted. We discussed with a lot of medical professionals, building professionals and gave you the concepts of infection control in hospitals. So, we talked about ARTS centers, we talked about DOTS centers, but there are lot of patients who are spreading infections and there are a lot of patients in hospital who are prone to get a lot of infection from the community because they are on immunosuppressants. So, we have done modules wherein we have explained all these planning, designing, detailing and safety precautions which have to be used by the users. So, we come to modules on accreditation of hospitals, the quality standards in hospitals, the NABH standards, the benefits of accreditation, the accreditation authorities in India and internationally. So, all these concepts have been given in the module on accreditation. We had modules on green hospitals where sustainability and green concepts were very well explained in terms of green guidelines, the benefits of a green hospitals, the concepts, the sustainability in design and the parameters for green hospitals, including case studies, examples and the costing of green hospitals was explained in modules. There were modules on safe and smart hospitals and hospitals of the future. So, we have talked about the past, the present, we had also to give you what is there in store for us in the future. So, but we have to ensure that the hospitals are safe from fire hazards, they have to be safe from the various natural and man-made hazards we have. So, there could be cyclones, there could be flooding, there could be various hazards which come to a hospital. Then it was very important to understand the services like water supply, medical gases supply, gases required for kitchens, for boilers, for air conditioning and how do we dispose the biomedical waste and recycle the recyclables which we have in an hospital. So, we did the NABL and the standards of labs which we require in a hospital. The biosafety standards in a hospital were covered in a separate module which talked about the elaborate types of hospitals, laboratories which we have. So, we also covered the laboratory design standards in healthcare delivery facilities. So, we did modules on communicable diseases with an examples of tuberculosis. Why? Because in India we are here trying to eradicate tuberculosis, but till now we have been talking to manage, to control tuberculosis in India. So, we have separate DOTS clinics, we have a hierarchy of these facilities, how do we plan them, where do we locate them, how do we ensure that the infection does not spread to the caregivers, to the community and to the other patients. So, we talked about the target audiences, the design principles, the materials and equipment which are required to maintain hygiene and the standard operating procedures required there. So, we did a module on BIM softwares, how the digital approach in architecture and by using the BIM software we can do detailed layouts, and at the simulation level itself we know where the various services are fouling, and this module gives us a detailed idea about the importance of BIM and its usage in healthcare settings. So, we did a module on design considerations for primary health centers, community health centers and the health sub centers. So, these are the units which we have at the peripheral level of the community, and what are the vertical and horizontal linkages of these facilities and how the use of telemedicine, technology, net connectivity is helping this. So, wrapping up this program, certain topics related to the management of healthcare facilities have been covered, such as the facilities management and the team members required to design, to construct and to manage these facilities, and their roles have been explained in certain modules. Apart from all this, certain other important topics that have been covered are healthy cities, the healthy city concepts, the concepts of the understanding of the relationship of healthcare delivery facilities, their horizontal and vertical linkages, the design processes required here, and we again reiterate and elaborate to you that please complete all your assignments by 31st of January 2020. This is an extended deadline given to you, and sit in your exam by early February, which is a Sunday date that has been announced for you. Please come and sit for the external exam which is conducted by the National Testing Agency, and email all your design assignments to us before the end of these deadlines to be eligible to earn your certificate of doing the internal and external grading for this program. Namaskar, thank you, Jai Hind.